Welcome. This is an overview of the Skills for Brain Health personalized module that's a part of the Treating Later Life Depression workbook and clinician guide through Oxford University Press. As you can see on this slide, Skills for Brain Health is one of a number of different personalized modules that we have available for clinicians and their patients or clients to pick as appropriate for a given presenting concerns or clinical issues that are coming up throughout treatment. One of the recommendations that we make is that unless you're already working within very brief formats, such as within integrated primary care, EAP models, care management, for the majority of psychotherapy, individual or group psychotherapy with patients, we'd like to encourage you to resist the urge to jump from module to module to module with great frequency. Oftentimes clinicians think that they're covering a lot of ground, and then clients or patients really find themselves sort of overwhelmed and confused as what they're supposed to do with all this information and all these ideas. And so because psychotherapy is really focusing on helping individuals build and utilize skills over time in daily life and during stressful life situations, we want to encourage you to think about a lot of the skills and work that you're doing using the Treating Later Life Depression workbook as building habits, right? Healthier, more functional habits in relating with somebody's emotional experiences and relating with one's internal dialogue and cognitions, and in daily life in terms of managing behavioral issues. And so we know that habit formation and habit change requires a lot of repetition, a lot of overlearning of adaptive skills, such that they're still there and still in place to use during high challenge, high stressful situations. And we certainly have a really nice deep literature in the psychology of habit to help us think about how we want to be doing that with our clients. So this orientation video is intended to provide a relatively brief overview of the Skills for Brain Health, Healthy Cognitive Aging personalized module. I'll be making a couple of tips and reminders about within session process, and I'll also be pointing out some of the page numbers where you can get additional information in the Treating Later Life Depression Clinician Guide. Individuals watching this are definitely going to get the most of this overview if you have both the Later Life Depression workbook and the clinician guide available and in front of you while you're watching this orientation video. So just, as we're getting started, I want to point out that for all of us, myself included as clinicians, we usually feel a little a specific intervention for the first time or using new materials. So I'd just like to encourage you to let that be okay. That commonly it takes all of us working through an intervention, working through new intervention materials with 2 to 3 clients to feel comfortable and to have a sense that it's our own. We've really made an effort in the Later Life Depression workbook to have the materials be as clinician friendly as possible. So that means that all the key points, recommended discussion questions within session with clients are provided on each of the learn pages and practice forms. So to really reduce that cognitive load, really reduce the pressure on clinicians to remember a lot of things on their own ahead of session. And so, for all of us, the best way to learn something is to actually roll up our sleeves and use it with clients. So I'd like to encourage everyone to not worry about being perfect in the application and just get started and to find out what works best for you. So in the clinician guide, the chapter on skills for brain health is in chapter 11 of the clinician guide, and that's module 5 of the workbook. And as you sort of see in terms of the variety of things that we're covering, there's a large number of both learn pages and practice forms. And it is true throughout this workbook, we are not expecting any given clinician or any given client to be using all the modules within the workbook or all the materials within the module. This is really intended to be a highly flexible pick and choose what is the best fit for the issues that are coming up for individual clients. Later on in this video, I'll be making a couple of recommendations on some of the forms that kind of hold together for those who are doing some focused psychotherapy time in the Skills for Brain Health module. But just know that there's a lot of materials there. You're going to be picking, or you're going to be like paging through and looking over and then making some decisions as to what are particularly relevant for individual clients and patients. So all of our work that we do with older adults is embedded with an understanding that age and generation is one of a variety of identities that are salient for individuals, that shift over time in their salience, and that intersect with additional identities to both shape who we are, what we value, as well as what forms of oppression or discrimination we may be experiencing. And so we really call upon and enjoy Pam Hayes' addressing model that really sort of honors and gives a sense of the variety of the identities that may intersect with each other to shape any given client's experiences. And so Pam Hayes makes a variety of really good suggestions in thinking about how to address diversity and culturally responsive CBT. And, everything that we want to do is through the lens of cultural respect. And so that's true for our assessment, for our early work in which we're really pulling for and paying attention to culturally related strengths and supports, and really sort of clarifying when are we helping our clients make adjustments to their environment to be a better fit for them, versus when are we helping clients make changes either in their thoughts or in their behaviors themselves. And so sometimes we're working to help clients shape their environments, and sometimes to make changes that are within themselves. So within the Treating Later Life Depression workbook, in the Skills for Getting Started module, we have a range of forms that are meant to help with therapy orientation and the early phases of clinical interventions. And I've just highlighted two in specific that we certainly find very, very helpful. The Celebrating Diversity Start, Love, and Learn page is an opportunity for therapists and clients to talk together about the personal identities that are most important for a given client and that may relate to the work that they're going to be doing in psychotherapy. It introduces the concept of chosen family, which is so important. And then there's attention to values and strengths in a within session practice form that allows you to begin the discussion within session, and then for the client to continue that work and focus on their personal values and their strengths that are most salient for them and that are important. So, if you have additional questions or you're interested in those early stages of therapy, or for issues that are specific to screening and assessment, in the clinician guide, we have chapter 3 that is devoted to assessment with a range of assessment recommendations. And then we provide Appendix D that has a clinician-friendly, ready to be used forms that are in the public domain that are available for your clinical use. In the Skills for Brain Health, we're really doing a number of different things. Some psychoeducation about healthy cognitive aging, so how our brains do and don't change as we age. There's some psychoeducation regarding the relationships between brain health and depression. There's a number of tools and recommendations and resources that are provided for individuals who want to prevent dementia and live a brain healthy lifestyle. And then we provide some resources that are specific to managing healthcare visits and medications. And then in addition to that, for some individuals, when they may be experiencing some cognitive changes that are not a part of normal cognitive aging, we provide some psychoeducation and resource sheets for when brain changes may not be due to aging and why someone might be interested in a formal evaluation for neurocognitive concerns and how to do that. So we provide resources for all of those things in the section. And a lot of our work is shaped by the growing literature on the opportunities we have to prevent dementia. And so here you see an image from the Lancet Commission on Dementia Prevention, and that you see that in that can be relevant and helpful in middle life, there are a number of things that individuals can do in later life that are modifiable risk factors for dementia. And I've highlighted here the three that we tend to focus on the most across the modules in this approach, which is certainly treating depression, reducing social isolation, and increasing physical activity and reducing sedentary lifestyles. And this image, as you see, which is rather busy, shows that in the work that we're doing, we are preventing dementia through three overlapping processes of increasing cognitive reserve, reducing brain inflammation, and reducing brain damage. And it's not insignificant that physical activity, exercise, is at the heart and does all three of those things, and that reducing depression and increasing social connectedness and a rich social network then helps both enhance and increase brain cognitive reserve and reduces brain damage. So in this Skills for Brain Health module, we're emphasizing those things quite a bit. So for that reason, you'll see in a number of the resources in this module, we're encouraging focus on and activation of physical activity of any kind, whatever is possible and recommended for that individual's health provider, and to encourage activities that help with connectedness in a variety of ways. So here's an example of an early, so I'm not going to be walking through every single learn form or practice sheet that are provided within the workbook in this module, but I'm just going to give you a sample of a couple of them to get a feel for it. So here's an example relatively early within the module of Health 7 Learn on what do we mean by brain healthy lifestyle, and really just sort of list that there's a variety of different things that individuals can do. What we know is that we typically make changes one area at a time with attention, that this isn't just making suggestions and people say, oh, okay, I'll do all those things, right? And so there's this list, and then there's an opportunity within an early practice form for a client to have 1 or 2 weeks in which they're really kind of looking at the range of these facets of brain healthy lifestyle in their daily life to identify what are the things that I'm already doing well, that are good for me and I can just continue, and then which of these are more of a stretch for me, and that might be the things that then are useful to focus on clinically. And so one of the things that we know is that middle-aged and older adults are very interested in whether brain games and what types of cognitive stimulation are actually enduring and result in important ways of preventing Alzheimer's disease and other neurocognitive disorders. And so we provide some information about the fact that it's really that something new every day and really stretching the brain. So if someone enjoys their daily Sudoku paper or Sudoku puzzle with their morning coffee, that's wonderful. That's a part of a engaged, enjoyable day, but that's not necessarily the type of thing that's then going to lead to sort of promotion of brain health. And so instead, we may, if somebody is interested in this part of cognitive stimulation as a part of their brain health, and we're really sort of emphasizing that they need to be doing something different every day of the week, as opposed to the same thing over and over again. So when we have a working the crossword puzzle, something that we enjoy, that's great. We get better at working crossword puzzles, but that doesn't necessarily then translate into other areas of cognitive functioning or to major benefits to the brain. So one of the things that we recommend across the entire treating later life depression approach is supporting healthy, accurate, informed communication with healthcare providers. And that's a big part of brain health as well. And so later on in the module, here's an example of a psychoeducation form in which we're introducing information about, within the United States, the annual Medicare wellness visit, how to think about it, how to request and schedule and plan for that visit. We have a practice form that clinicians and clients can use together to prepare ahead of a visit with their health provider to take in with them. And we can find those sort of communications really important. And then, as I indicated, we have material towards the end of the module for individuals who do have concerns about their brain health and may be appropriate for a more formal evaluation, as we, then sort of present the information of why bother, what are some of the benefits to an evaluation if there are concerns. And what we're emphasizing in our communications with clients and patients is that there are so many medical conditions that can lead to cognitive changes. And oftentimes an evaluation may well be able to detect something that's treatable and reversible. And that's one of the first and most important reasons for a good assessment and evaluation workup, in addition to others. So as I indicated, I wasn't planning in this overview to walk through all the materials. I know that having 25 different learn pages, which are single page sort of informational sheets, as well as practice forms, can be overwhelming. But over time, as you page through, you're going to have a sense of clients who have an interest in a specific area, and then you're individually picking the that are the best fit for them. So I'm going to walk through a couple for individuals who do want to do some focused, concentrated work in this area with a client in weekly individual psychotherapy. What might this look like? So this is just recommendations, and in any given situation, this could certainly vary. So this is by no means a prescription of exactly what should happen in every session. But here's an example of some of the early learn pages that provide some psychoeducation about healthy cognitive aging and the relationships with depression. Early on, we're continuing that review of treatment goals, and then also encouraging a early attention on, like, well, what is my cardiovascular status right now? Because so much of cardiovascular health is so linked to brain health in a number of ways. And then in session 2, then we're having more of that conversation surrounding of all the variety of things that we know goes into brain health for any given client. What might be some areas that they want to focus on? So it's a beginning of a conversation of, what might that be in my life? Not just that I'm already doing and I want to continue to maintain and keep those healthy practices happening, but which are further areas of stretch for me, or challenge, and how am I in session we be able to help facilitate some attention to those areas. So that then transition into the third session, where absolutely you would not be using all these forms, but this is just a range of the choice of forms that are sort of focused on everything from physical activity to healthy food and drink, to social connectedness, to stress management, learning new things, healthy sleep habits. So again, we would typically say you're doing no more than 2, and usually just 1 of these areas at a time, in terms of both some recommendations and some opportunities to practice those skills and those activities between sessions. And then in session 4, we organize together the information that's more specific to managing healthcare and medications, and especially that communication and contact with a primary care provider. So you see that in session 4. And then in session 5, if we're then keeping this in a relatively short package, then we're both reviewing that information and helping them think about how they may want to set personal goals related to brain health that they continue to work on, either as a part of their individual psychotherapy or just continuing after therapy or on their own. So we provide tips in the clinician guide, and the tips for clinicians in this module are provided on pages 186 and to 188 within the clinician guide. And we certainly want to recognize the importance of culturally specific beliefs about cognitive health, and we provide some information and recommendations there for that key part of supporting social connections and social connectedness in a variety of ways. And then we understand that some clinicians will be working with individuals who have mild cognitive impairment or who may already have and be at the early stages of an identified neurocognitive disorder like Alzheimer's. And so we have some recommendations for how you modify the sessions to accommodate for someone who does have mild cognitive impairment or neurocognitive disorder. As I indicated at the beginning of this overview, the approach that we take is that information and suggestions are great, that we like to have conversations that increase insight, but that we don't believe that insight automatically leads to behavior change. If that was true, there would be a lot, we'd have a lot healthier individuals within our society. So for those of you who are working in psychotherapy, the emphasis is on the systematic, sustained attention. And we'd like you to continue to use that term, that concept of habits, which is very familiar with older adults. It's a lovely way of connecting the work that you're doing and emphasizes that importance of repetition and overlearning. And again, to encourage you to not try to accomplish too much. This is a big module with a lot of different options, but we encourage you to only focus on one or two areas of change: sleep, physical activity, changing eating and food, managing stress, learning new things, staying social connected. Focus on one or two areas of change at the same time as we're helping clients build healthy habits. So to learn more, I'd refer you again to chapter 11 within the clinician guide for treating later life depression. And as we sort of wrap up this overview slide, I just want to make a couple of points regarding some of the ongoing recommendations we make for this whole treatment approach. We're at the point within our literature in psychotherapy that the importance of routinely tracking and monitoring outcomes is so clearly related to improved client outcomes that it's now really can be considered an ethical part of clinical practice. So in the Treating Later Life Depression workbook, in every single module, we provide some tools to help you do that. The very, very first practice form within the module provides an opportunity for you and your clients to look at what their ongoing psychotherapy goals have been, to rewrite those down, and to do a reassessment of where they're at this phase in treatment. There's also later on in the module an opportunity to then revise some goals or to take away one of the previous therapy goals and to add in a goal that's very specific to improving brain health. And then we have in every single module, towards the end of the module, a reminder of how progress happens in behavioral health. And that as opposed to just a linear progress or stair-step progress, the change happens in a very disjointed, sawtooth pattern with improvements and setbacks, and that we have that expectation that we're making strides and we're having little setbacks with changes in daily life or additional stressors, and that the value of routinely tracking outcomes session by session is to help see progress over time in light of those setbacks that can happen from time to time. So we have some recommendations within the clinician guide in general on how to keep your session structured to maximize the effectiveness. Those tips are in pages 79 to 81. One of them is really paying attention to how you're beginning your sessions with a warm greeting, but with not an invitation to start sharing how the week has been or what they want to talk about. I'm just going to say, Maria, it's so good to see you. Let's get started by looking at your scores on your therapy goals, and then we'll make a list of the topics for today. We provide some resources in the workbook for this. In the Skills for Getting Started module at the very beginning of the workbook, we provide an opportunity for clients and clinicians to just plan the client taking a couple of minutes before the therapy session, either the night before or the morning of, to do some preparation of the session ahead of time. And that can go so far in improving the quality and the effectiveness of the time that you have together. I'd like to encourage you to stay specific and avoid overly abstract discussions, that we want to have the majority of our session time focused on that can be given a date and a time to them, and that we are emphasizing that between session practice as integral to how change occurs. And so we use the phrase home practice. We've kind of stepped away from the word homework. We use the phrase home practice in wanting to emphasize that this is collaborative, that we're already starting this in session, writing in an example, planning on specific days and times when they'll be doing this work between session, and then proactively problem solving what might get in the way. And we provide some recommendations for that in the clinician guide on pages 71 and 72. And then similarly, we'd like to encourage you to get in the habit of allowing enough time at the end of session for a very brief session summary, where you're guiding your clients through on their end, that they're writing down in their own handwriting just a couple words and phrases to summarize what the main points were from the session, what the plans are, and whether they're going to have anyone else in their life help them and support them in that efforts. So session pacing is a pretty important thing. You need to have enough opportunity at the end of session to do that end of session summary, to clarify whether there are any questions, to check in at the end of session for feedback, and to provide some hope installation, and to point out the areas that give you hope about their progress and that you see that are very encouraging. And so with that in mind, we also provide at the very end of this module a one-page review sheet where they can check off the things that they've worked on and how they might want to work on this and continue to apply this in the future. We provide some tip sheets at the Optimal Aging Center that are freely available and downloadable, that summarize some of these core strategies within session. And then there's also some opportunities for continued consultation through the Optimal Aging Center. With that, we finished our overview for skills for brain health, and I hope that this overview has been helpful.